next generation sequencing is being used very commonly nowadays to assess for mutational profile of patients when they are diagnosed with leukemia. This has led to the finding that several patients with B-cell acute lymphoblastic leukemia possesses mutations which were commonly associated with myeloid-type leukemias like MDS and AML. Recent data from other groups have shown that the presence of these myeloid-type mutations could lead to inferior outcomes with chemotherapy-based regimen. These myeloid-type mutations are also more common in older patients with ALL, which are a group always known to be more challenging to treat. And as a result, we wanted to understand the outcomes of patients with B-ALL who possess these myeloid-type mutations and what happens to them when they receive chemotherapy plus a targeted drug. So thankfully at MD Anderson, we are able to treat patients with chemotherapy plus some form of targeted drug like Inotuzumab and or blinatumomab in the front line. When we evaluated the impact of myeloid mutations in these patients and compared to those who did not have myeloid mutations or myeloid-type mutations, we saw on univariate analysis that maybe the myeloid-type mutations could be associated with slightly inferior relapse-free survival and overall survival. But when we put together other factors including cytogenetics, age, type of therapy, etc., the presence of myeloid-type mutations did not have an independent prognostic outcome or prognostic impact when patients were treated with frontline immunotherapy-containing regimens. Similar data from other groups have shown that ALL cells which have myeloid-type mutations and exposed to blinatumomab-based therapy, these myeloid-type mutations don't necessarily need to treatment resistance. And we, for the first time in a clinical cohort of patients, show that these myeloid-type mutations, again when treated with frontline immunotherapy-based regimens, might not necessarily need to poor outcomes based on our multivariate analysis.